few days and the early weeks of the pandemic. We first saw it happening overseas, and I certainly didn't understand how quickly it was going to come to our community. But it did arrive in our community very quickly, and it became apparent to us that our hospitals were going to have a really bad time dealing with the pandemic and treating all the patients that were about to hit, to the point that they were likely to become overwhelmed and then not be able to care for patients with heart disease or cancer or stroke, some sort of an emergency that they just simply would be overwhelmed and couldn't deal with it. And we heard from our hospital administrators that they were just extremely concerned, and they had gone to the governor. The hospital administrators across the state had gone to the governor and asked him to put a shelter-in-place order in for the entire state to let them prepare and slow things down a little bit. And when the governor decided not to do that, Dallas County issued their order. We were in talks with the hospitals and also with Dr. Verner, our health authority for McLennan County, and with other medical professionals. And we saw that it was going to have to happen. And it was a matter of whether you do it today or tomorrow or you wait a week. But it was going to have to happen. And we made the decision that it was going to have a greater impact on stopping or slowing the spread of the coronavirus than it would have on the economy. We knew that it would have a terrible effect on the economy, but adding or doing it a week earlier seemed to be less of a concern for the economy than it was for the virus. And so, we made the decision to go ahead and issue that emergency order with the shelter in place in it. And it was the day after Dallas County had issued theirs, and we had a much higher percentage of COVID patients per capita at that point than they did in Dallas. And so we went from being one of the highest per capita COVID infections in the state in McLennan County to one of the lowest in a very short time. And so I think, in hindsight, it was a terrible decision to have to make, but it wasn't not a very difficult decision in terms of weighing the pros and cons and seeing that that was the thing to do at the time.